Well, thank you, Senator Alexander and Ranking Member Murray, for having this hearing, and thank you to our panelists for just excellent testimony and for the work you do. I am the mom of a young man who is approaching his 30th birthday who happens to experience very severe cerebral palsy and a whole bunch of the related conditions that come with that. And I have observed over the course of his lifetime, he lives at home, supported with an awful lot of direct care, but also at home because of medical technology and pharmaceuticals that we didn't have a generation or two ago. So I'm always reflecting on the fact that the model of training and workforce deployment that we have and the kind of conditions that patients now have and the settings in which they are living their lives are somewhat misaligned. We have more people with severe disabilities, more people who are aging, and we also have some different kinds now of diseases like opioid use disorder that we are trying to treat. And what this hearing to me seems more than anything to be about is really how we let our deployment models catch up to the population we're really trying to treat in the setting that they all live in. So I have three questions about that I probably won't get through all three, but let me start, Dr. Sanford, with you. In your testimony, you describe a new grant that James Madison University was just awarded related to the nursing workforce. It's a partnership to educate baccalaureate-prepared nurses to work in community settings to address the opioid crisis. Rivier University, a school in Nashua, New Hampshire, just received a Title VIII Nurse Education Practice Quality and Retention Grant for the upcoming fiscal year. The goal of Rivier's grant is similar to a grant you described in your testimony, to prepare nurses to go into careers in community-based primary care settings to help them address the opioid epidemic. One aspect of Rivier's grant is to increase nursing students' clinical rotations in primary care settings. So in your experience, how has exposure to community settings changed the ability of nurses to be ready to care for patients and families impacted by public health crises like opioid addiction?
Thank you, Senator Hassan, for the question. In my experience, whenever we have clinical rotations in community settings, it exposes our nursing students to the opportunities that sometimes they don't consider. A lot of times when we're going through acute care facilities for our clinical, they think of nursing as being in the hospital. But we all know that healthcare is shifting out into the community and more needs are in the community. So partnering with rural health clinics, partnering with critical access hospitals is very important as we look at training the next generation of nurses. I see that they will, anecdotally, students tell us that if they have strong preceptors, so preceptor training is important as well.
Right.
If they have strong preceptors, that will impact the choice of where they choose to practice.
Excellent. Well, thank you for that answer, and thank you for your work. Dr. Phelan, in your testimony, you discussed the work of the Northwest Geriatrics Workforce Enhancement Center. While your main focus is on training for primary care providers in geriatrics, you also mentioned that workers on the, quote, front lines of hands-on daily care, including family caregivers and home care workers. In New Hampshire, it's estimated that 70 to 80% of paid hands-on care for older adults and individuals who experience disabilities is provided by direct care workers, including personal care aides, home health aides, and nursing assistants. The demand for direct care workers is expected to increase 49% between now and 2022, further exacerbating a workforce shortage that already exists in many communities across the country. Beyond high-quality primary care, we know many individuals' long-term success in the community hinges on the direct support that they get at home. So, Dr. Phelan, drawing from your experience with geriatric workforce initiatives, what can Congress do to support the recruitment, training, and retention of high-quality direct care workforce now and in the future?
Thank you for that question. Part of the issue is, again, fundamentals, making sure that those individuals are well prepared for the position that they are seeking to fill.
Yeah.
Direct care workers, as you say, are at the front lines doing hands-on daily care for people who are at home living with chronic illnesses, if they're elderly, often with dementia. There are competencies around care, for example, of a person with dementia, and understanding of their particular health risks and safety concerns that are necessary and integral to preparing a home care worker to be there and be that person, that one-on-one person on a daily basis. One of the ways that we're currently doing this through the geriatrics workforce enhancement programs, at least speaking of our GWEP in Washington, is we're taking the broadest view of who is primary care. We're including home care workers as part of our audience for training. Just recently, we have a program called Full Life, which is an adult day health program in Western Washington. Adult day health is a entity similar to daycare for children, except it has more of a health orientation, and its audience is older adults or people living at younger ages with disabilities in the community. The staff of Full Life is now participating in a number of our training activities that we offer so that they're getting the same exposure to the geriatrics competencies that, say, the family medicine residents that we're reaching across the family medicine residency network are getting.
Thank you. Thank you very much, and thank you, Mr. Chair, for allowing me to go over.
No, thank you, Senator Hassan.